Hello everyone, welcome back to the channel. Today we are discussing about concept of pharmacokinetics, mainly absorption. For more details, check out the link in the description below. Don't forget to like and subscribe for more updates. We have previously talked about what is pharmacokinetics. So pharmacokinetics is what the body does to the drug. It means how our body deals with the drug. The movement of drug in our body is known as pharmacokinetics. So pharmacokinetics is the quantitative study of drug movement in, through and out of the body. Pharmacokinetic considerations therefore determine the route of administration, dose, latency of onset, time of peak action, duration of action, and frequency of administration of a drug. All pharmacokinetic processes involve transport of the drug through biological membranes. If we are taking a drug, how much amount are absorbed, how much amounts are distributed, how much amount are metabolized, and how much amount are excreted out. These all parameters are comes under pharmacokinetics. So this is the pharmacokinetic study of a drug. For example, if you are taking a drug in tablet form, these drugs come into the GIT, disintegrate and dissolution occurs. After that, these drugs will absorb. This is the first parameter of pharmacokinetics. After that, these two forms are coming. Here are the free drugs and the bound drugs. In drug have plasma proteins which converts the drug in bound form. After that, it comes to the site of action and storage tissue. So second part of pharmacokinetic is distribution. After that, it is metabolites and then excreted out through urine, bile, feces, sweat and saliva. So these all about pharmacokinetic parameters. Next is the membrane transport. It means how drugs across the biological membrane. For a drug to be absorbed and distributed into organs and tissues and eliminated from the body, it must pass through one or more biological membranes or barriers at various locations. Such a movement of drug across the membrane is called as drug transport. This is a bilayer about 100 angstrom thick of phospholipid and cholesterol molecules. It means for absorption, distribution, and excretion, drugs should cross the biological membranes. This is the bilayer about 100 angstrom thick. Hydrocarbon chains are oriented inwards to form the hydrophobic or lipophilic phase, and they are polar head oriented to form the outer and inner hydrophilic boundaries of the cellular membrane. So this is the diagram of lipoidal membrane. There is polar head, non-polar tail. In middle there is the lipid layer along with protein. It is the basic of the cell membrane. Next we are discussing about absorption. So what is drug absorption? Drug absorption is defined as the process of movement of unchanged drug from the site of administration to the systemic circulation. It is difficult to measure the drug concentration at site of action. Instead, the concentration can be measured more accurately in plasma. If I am taking a drug for kidney, after absorption, it's impossible to measure the concentration. That's why we measure the plasma concentration. Next is the mechanism of drug absorption. Three broad categories of drug transport mechanisms involved in the absorption. First is the transcellular or intracellular transport. Second is the paracellular or intercellular transport. And third is the vesicular transport. Transcellular or intracellular transport. Passage of drugs across the GI epithelium, most common pathway for drug transport. More than 90% of the drugs are absorbed by this pathway. Second is the paracellular or intercellular transport. Transport of drugs through the junctions between the GI epithelial cells. This pathway is of minor importance in drug absorption. Last one is the vesicular transport. Transport of substances within vesicles into a cell. Examples are pinocytosis and phagocytosis. This diagram represents these three mechanisms of drug absorption. So this is the transcellular absorption of drug. Drug is transformed from one cell and go to the capillaries, and this process is called as the passive diffusion. This is the transcellular and intracellular absorption of the drug. Next is the paracellular. In paracellular, drug is absorbed in between two cells and then go to the capillaries. A second pathway of drug absorption is paracellular. or intercellular absorption of the drug. And the third pathway of drug absorption is the vesicular transport. Drug is transferred by the help of the vesicle. In that case, phagocytosis and pinocytosis terms are coming. Phagocytosis means cells are eating, means any solid drug are transferred by this vesicle, and pinocytosis means cell are drinking, means liquid drug are transferred by the vesicle. Next, we are discussing about bioavailability. How we understand about bioavailability? Bio means biological system, and availability means how much amount are available. Bioavailability is defined as the rate and extent amount of absorption of unchanged drug from its dosage form. It is a measure of the fraction of administered dose of a drug that reaches the systemic circulation in the unchanged form following administration by any route. The area under blood concentration time curve is a common measure of the extent of bioavailability for a drug given by a particular route. Bioavailability of drug injected intravenous is 100% but frequently lower after oral ingestion. This table represents the different bioavailability for different route of administration. For intravenous, the bioavailability is 100. For intramuscular, bioavailability is 75 to near about 100. For subcutaneous, bioavailability is 75 to near about 100. For oral, bioavailability 5 to less than 100. So, bioavailability of oral is very less.